Yeah, Assalamualaikum warahmatullahi wabarakatuh, and a very good day. So today our group will present the discussion on the culture of quality at Arnold Palmer Hospital. So this is the video case study that we have discussed. So on this presentation, we are going to have four questions, and the discussion on the first one is why is it important for Arnold Palmer Hospital to get a patient assessment of healthcare quality, and does the patient have the expertise to judge the healthcare she received? So the important for the Arnold Palmer Hospital to get patient assessment of health quality is because they want to seek feedback from patients that it will help the hospital in knowing customer expectation, which is important in improving their service. The second one, the patient's opinion of the quality of the medical service is crucial because they need to know if patient satisfaction meets both their own and the industry standard. And as we all know that patients are the ones who are being treated and they are the best capable of judging the healthcare service that they get. Also, patients have the best understanding of the type of service they should receive. Patient assessment enables them to improve performance and achieve better result. And also it helps in providing the staff with the information they need to improve performance, which would lead to better patient satisfaction. It also keeping patients and their families satisfied is essential for the hospital's success and growth. Poor customer service may result in negative word of mouth that the hospital wants to avoid. And lastly, patients today can judge better regarding their healthcare quality than anyone else. When patients are given quality service experience and provided with the detailed information on their health problem and the corresponding medical diagnosis and treatments, they will be in a position to judge the healthcare they receive. So on the second discussion, I will pass to Diana for the discussion.
Alright. Thank you, Director Aini. Okay, here the question number 2. How will you build a culture of quality in an organization such as Arnold Palmer Hospital? First, building a quality culture in a company such as Arnold Palmer Hospital is with excellent care being Arnold Palmer Hospital goals. So the Arnold Palmer Hospital prioritize their client happiness. The hospital organizes initiatives such as daily questionnaires to better understand the needs of patients. The hospital provides newborn and pediatric intensive care, cardiology, and pediatric cancer in terms of consumer value for receiving the treatment. Arnold Palmer Hospital is mandated to concentrate on client service as well as many internal indicators such as tracking staff performance. Other than that, to reach this objective, administration must emphasize first the teaching, equipping, empowering, coordinating, implementing efficient and effective processes. The hospital's mission and vision statement, which is always on display in public, must represent the hospital's goal of delivering exceptional healthcare. The leadership team should drive the institution toward establishing a passion for providing quality on purpose. Measurable criteria as well as performance benchmarks should be developed. So here the third question, which is what techniques does Arnold Palmer Hospital practice in its drive for quality and continuous improvement? First, the Arnold Palmer Hospital emphasize quality and process improvement. The customers can determine the quality of health care they receive due to the development of comprehensive and scientific tools. Arnold Palmer Hospital consistently ranked in the top 10%. Employers can also be given up to $200 to patients who have grounds to complain about hospital services such as meals, kindness, attentiveness, or cleanliness. Pareto charts and flowcharts are used to provide hospital workers with an overview of what is going on in the hospital in comparison to internal rules and external national regulation, which is the Pareto charts distinguish the few important factors from the many less significant ones, while the flowcharts are diagrams that graphically illustrate a process or system. Furthermore, administrators of Arnold Palmer Hospital have realized that quality is not just the duty of top management. New workers are given through orientation of quality, customer certification, and their role in continual improvement. And the last one, a need of a 24-hour call bedside service was identified to improve the hospital response to patients' health care and other demands. So the last question I will forward to Anik Fana.
Hello. Good evening. I'm Anis. Today I'm going to present on the cause and effect diagram of Arnold Palmer Hospital quality variables for a patient that just gave birth. So we are going to go deep dive into how Arnold Palmer become one of the best. And we are going to look into measurement, material, machine, environment, method, and man as part of the criteria of the fishbone diagram. So the first one, I'm going to talk about measurement. How Arnold Palmer measures their success. Okay, number one, they do scorings on patients' satisfaction scores from surveys. So basically, they will conduct surveys after 2 weeks of their patients being released from the hospitals. And then they also have a check sheets, scatter diagram, cause and effect diagrams, Pareto chart, histogram, flow chart, and SPC. So in this case, they mostly use Pareto chart to distinguish the critical issue over the lesser importance issues. And they also use flow chart as part of their SOP, standard operating procedure, so that it is all standardized across the hospital. Next is material. So they also provide gifts and values for about $200 to patients that manage to find anything to complain about in the hospital services. So basically, they are rewarding their customer if the customer has anything to say to improve their process further. And then they also provide table cards on their patient's bedside table for them to actually provide the feedbacks and opinions to the hospital. So the customer has easy access to stress out their opinion or any concern that they feel towards the hospital. Next are the machine. What are the machine that is being used in our non-palmer that is considered um, the tools that makes them successful, which is number one, they have a cell phone that links to all administration 24/7. So all the administrators are able to be contacted 24/7 by the patients, and also they have executive dashboard visible to staff in the hospital so that they can view their performance. So basically, when you can see your KPIs and when you can see your goals being displayed and met, it will naturally boost your motivation to further improve and to further continue your success. And okay, moving forward, we are going for the environment. So environment in the hospital, they have sufficient beds for patients. So basically, they have 431 beds, and then they have broad service area that covers 18 counties, and then they also provide broad range of medical services. So basically, with broad range services, with broad range of coverage in terms of the counties, they basically covers the important aspect of a business so that customer are more prone to go to the hospital because it is well known and it covers most of the areas. And then the method. Okay, they also implement total quality management implementation in the organization, and also they focus also on tangible medical successfulness, basically with more higher rates medical successfulness, high rates of life expectancy, the better it is. And then they also promote continuous improvement culture in their staff, and in basically in the entire hospital had a continuous improvement mindset. And then they also deliver the quality of services as promised. So basically, when they already promised to their patients that they provide a good quality service, they deliver it. And then it also has in-depth surveys for to patients feedback. So basically, they really focus on getting feedbacks from their patients and what they can improve further, and also they have plans on handling problem. If there's an issue in the hospital, they also plan on how to overcome the problem. So basically, they can tackle everything, future and also the problem. And then in terms of manpower, basically they have competent doctors and nurses reliability. So basically, even if you have a very successful hospitality towards your patient, but if your doctors and nurses are not competent, it's not a good hospital to be introduced to others. But with these competent doctors and also nurses in the hospital, so basically patient has more confidence in them, and then they have effective communicator staff, so their staff also able to communicate properly with their patients, able to tell their patients on time on what is going on to their personal health, and also they has a process improvement team. So basically, with a built-in process improvement team, they basically have a team that can tackle or identify any problems and issues or future digitalization for the organization. It can be implemented successfully because they have a dedicated team. That's all from me. Thank you.